Question 1. A 45-year-old established patient presents to the clinic for an annual physical exam, during which the patient mentions a new symptom of chronic shoulder pain. The physician addresses the shoulder pain, completes a focused exam and orders an X-ray. What CPT codes and modifiers should be reported? A. 99396, 99,213-25. B. 99,213-25, 99396. C. 99386, 99,213-25. D. 99396, 99,214-25. Answer. A. 99396, 99,213-25. This question tests the coding concept of reporting a separately identifiable evaluation and management (E/M) service on the same day as a preventive medicine service. The keyword annual physical exam points to a preventive medicine code 99396 for an established patient 40 to 64 years old, while the new symptom of chronic shoulder pain indicates a problem-focused E/M service 99213 is appropriate for a low-complexity problem. When a significant, separately identifiable problem E/M service is performed outside of the preventive service, both codes are reported, and modifier 25 is appended to the problem E/M code 99213 to indicate it was distinct from the physical. A practical example is a patient getting their wellness check and also asking the doctor to treat a new rash. The takeaway tip is that the preventive code is never appended with modifier 25 because it is the primary service, but the problem-focused E/M code always requires modifier 25 in this scenario. Question 2. A patient undergoes an arthroscopic medial meniscectomy, removal of meniscus, on the left knee. What is the correct CPT code? A. 29,880. B. 29875 LT. C. 29,881-51. D. 29881 LT. Answer. D. 29881 LT. This item tests the application of CPT codes for knee arthroscopy, specifically the difference between a meniscectomy and a repair. The keyword meniscectomy indicates the removal or excision of the meniscus, not a repair, and the CPT code 29881 describes an arthroscopy with meniscectomy, medial or lateral. Since only one procedure, medial meniscectomy, was performed on the left knee, code 29881 is selected, and the anatomical modifier LT left side is appended to indicate the location. Code 29880 is incorrect because it describes a meniscectomy and a chondroplasty, which was not documented. Remember that meniscectomy means removal, like 29881, whereas meniscophy means repair, like 29882. Question 3. A 67-year-old patient is seen for surgical excision of a malignant melanoma measuring 1.5 centimeters with an excised diameter of 2.5 centimeters on the arm. The primary closure was performed. What is the correct CPT code? A. 11,603. B. 11,602. C. 11603, 12031. D. 11,403. Answer. A. 11603. This question tests the guidelines for coding the surgical excision of a malignant lesion from the integumentary system, 60,000 series. The keywords malignant melanoma, surgical excision, and arm confirm the use of the 11600 series, and the CPT code selection is based on the excised diameter of 2.5 centimeters, which converts to 2.1 to 3.0 centimeters. CPT code 11603 is for the excision of a malignant lesion on the trunk, arms, or legs when the excised diameter is between 2.1 centimeters and 3.0 centimeters. Simple closure is considered standard and is bundled into the excision code, so you do not report a separate repair code. Always remember that CPT codes for lesion excision are based on the excised diameter, which includes the lesion plus the necessary margins, not just the lesion size. Question 4. A patient is diagnosed with malignant neoplasm of the upper outer quadrant of the right breast. How is this primary diagnosis coded in ICD-10-CM? C50.419. B. C50.911. C. C50.411. D. C50.421. Answer C. C50.411. This question tests the ICD-10-CM coding guideline for neoplasms, requiring the coder to search the neoplasm table correctly. The main terms are neoplasm, malignant, and the anatomical site breast, specifically the upper outer quadrant, and the laterality right. Following the neoplasm table, the correct code is found by locating breast, upper outer quadrant in the malignant column, which leads to the specific code C50.411. Codes that end in 9, like C50.419, indicate unspecified laterality, and 911 indicates an unspecified site of the right breast, making them less specific than the correct answer. The takeaway tip is that ICD-10-CM codes must be reported to the highest level of specificity, including laterality and the specific quadrant when available. Question 5. Which of the following medical terms means surgical puncture to remove fluid from a joint? A. Arthroplasty. B. Arthroscopy. C. Arthrodesis. C. Arthrocentesis. Answered. D. Arthrocentesis. This question tests basic medical terminology, focusing on the suffixes related to surgical procedures. The root word arthro- means joint, and the suffix centesis means surgical puncture to aspirate fluid. This directly matches the definition, contrasting with plasty, surgical repair/reconstruction, scopy, visualization/inspection, or DESIs, surgical fusion/fixation. For example, a physician performs arthrocentesis to sample fluid from an infected knee joint. An easy way to remember the correct term is that centesis sounds like sentry, which is a guard, and the procedure involves puncturing or going through a barrier to get to the fluid. Question 6. A 55-year-old patient who suffered a stroke develops dysphagia, requiring a percutaneous endoscopic placement of a gastrostomy tube. Which CPT code is reported? A. 43,760. B. 43,246. C. 49,440. D. 43,752. Answer B. 43246. This question tests the correct CPT coding for a procedure in the digestive system chapter 40,000 series, specifically the placement of a feeding tube. The keywords percutaneous endoscopic placement of a gastrostomy tube are the direct description of the procedure. CPT code 43246 describes esophagogastroduodenoscopy (EGD), with directed placement of a percutaneous gastrostomy tube. Code 49440 is incorrect as it describes the radiological placement of a gastrostomy tube, and 43752 is for the placement of a naso- or orogastric tube. Remember that the code selection for tube placement often depends on the method used, such as whether it was done endoscopically, radiologically, or surgically. Question 7. A patient presents with acute on chronic systolic congestive heart failure. What is the correct ICD-10-CM coding sequence? A. I50.21 I50.22. B. I50.22 I50.21. C. I50.20. D. I50.9. Answer. A. I50.21 I50.22. This question tests the ICD-10-CM guideline for sequencing when a patient has a condition that is described as acute on chronic. The key guideline states that when a condition is documented as acute exacerbation, acute on chronic, the acute condition is coded first, followed by the code for the chronic condition. In this case, I50.21 acute systolic congestive heart failure is sequenced before I50.22 chronic systolic congestive heart failure. This sequencing is crucial because it accurately reflects the severity of the patient's current presentation. The takeaway tip is simple. For acute on chronic conditions, always remember the A before C rule, meaning acute code first, then chronic code. Question 8. A surgeon performs a total thyroidectomy for a malignant neoplasm. The surgeon also dissects the central neck lymph nodes unilateral. What CPT codes are reported? A. 60240-38500. B. 60240-38510. C. 60240-38700-51. D. 60240. Answer. C. 60240-38700-51. This question tests the coding of complex procedures in the endocrine system, specifically the combination of a total thyroidectomy and a lymph node dissection. The key guideline is that a lymphadenectomy, removal of lymph nodes, is separately reportable when performed with a thyroidectomy if it is not incidental. CPT code 60240 covers the total thyroidectomy, and CPT code 38700 describes the limited lymphadenectomy or excision of one or more lymph nodes in the central neck. Because 38700 is a separate, non-bundled procedure, it must be reported with modifier 51, multiple procedures, since it is performed at the same session as the primary surgery, 60240. Always check the CPT code notes and NCCI edits. If a lymph node dissection goes beyond a limited scope and is considered separate, report it with modifier 51. Question 9. A patient is scheduled for a bilateral screening mammography. Which code is used to report this service? A. 77067. B. 77066. C. 77065. D. G0202. Answer. A. 77067. This question tests the correct reporting of radiology and HCPCS Level 2 codes for screening services. The keyword bilateral screening mammography is the key indicator, and while CPT codes 77065 to 77067 describe mammography, code 77067 is specifically for a screening mammography, bilateral, including computer-aided detection (CD), when performed. Code 77066 is used for a diagnostic mammography, and G0202 is a Medicare-specific HCPCS code that was previously used but is now generally superseded by the CPT code for all payers. The takeaway tip is to always check if the service is a screening, routine checkup, or diagnostic, investigating a symptom, procedure, as the correct CPT code or HCPCS code will vary based on this distinction. Question 10. A physician provides initial cast application for a closed distal radius fracture in the emergency department. What CPT code is used for the casting application? A. 25605. B. 29075. C. E/M code only. D. 25605, 29075. Answer. E/M code only. This question tests the global surgical package concept as it applies to fracture care, which is a common CPC area. The keywords are initial cast application and closed distal radius fracture. According to CPT guidelines, when a physician performs the initial treatment of a fracture, the CPT code for the definitive treatment, like 25605, which is closed reduction, includes the application of the first cast/splint and the subsequent routine follow-up care. Therefore, only the E/M code should be reported for the visit, as the casting application itself is bundled into the definitive fracture management procedure, even if the procedure code is not billed on this date. Here's an easy way to remember. The E/M covers the decision-making and initial assessment, and the definitive fracture treatment, once decided upon, includes the initial splinting/casting as a bundled service. Question 11. Which CPT modifier is appended to the second procedure code when a surgeon performs a cholecystectomy and an appendectomy during the same operative session? B. 59. T. 51. D. 79. Answer. C. 51. This question tests the correct application of CPT modifiers for multiple surgical procedures performed during the same operative session. The two procedures, cholecystectomy and appendectomy, are distinct, separate procedures that are not bundled together by CPT guidelines or NCCI edits. Modifier 51, multiple procedures, is appended to the CPT code for the secondary, lesser valued, procedure to indicate that multiple procedures were performed. Modifier 59 is used to indicate a distinct procedural service, usually for codes that are normally bundled but are separate in a specific case. The takeaway tip is to use modifier 51 when reporting multiple separate surgeries. It tells the payer that reduced reimbursement may apply to the secondary procedure. Question 12. A patient undergoes repair of a torn rotator cuff and a subacromial decompression, acromioplasty, through an arthroscope in the same shoulder. Which codes are reported? A. 29824, 29822-51. B. 29827, 29826. C. 29827. D. 29827, 29826-59. Answer: C. 29827. This item tests the application of CPT codes for complex shoulder arthroscopy procedures and the concept of code bundling. The key procedures are repair of a torn rotator cuff and subacromial decompression. The code for arthroscopic rotator cuff repair, 29827, is a comprehensive code that includes the subacromial decompression, acromioplasty, which is described by code 29826, according to CPT guidelines and NCCI edits. Therefore, only the comprehensive code 29827 should be reported. For example, if the documentation explicitly lists both procedures, you still only report the higher-valued, most comprehensive code. Remember that when one procedure, like the decompression, is an integral component of a more extensive procedure, like the cuff repair, only the comprehensive code is reported. Question 13. Which organization is responsible for the development and maintenance of the Healthcare Common Procedure Coding System, HCPs? Level 2 codes. A. World Health Organization, WHO. B. American Medical Association, AMA. C. Centers for Medicare and Medicaid Services, CMS. D. American Health Information Management Association, AHIMA. Answer: C. Centers for Medicare and Medicaid Services, CMS. This question tests the foundational knowledge of the different coding systems and the organizations responsible for them. The concept is knowing the primary author and maintainer of each code set. HCPCS Level 2 codes are primarily used to report supplies, equipment and services not found in CPT, and the key organization responsible for these national codes is the Centers for Medicare and Medicaid Services, CMS. The AMA is responsible for CPT while the WHO maintains ICD. It is important to know that CPT is Level 1, and HCPCS is Level 2, often summarized as CMS handles supplies, AMA handles procedures. Question 14. A patient has an initial encounter for a displaced supracondylar fracture of the right humerus. In the ICD-10-CM code for the injury, which seventh character extension is required? A, V, B, C, D, C. Answer: B, Th. This question tests the required use of the seventh character extension in ICD-10-CM codes for injuries and external causes. The keyword initial encounter dictates the correct extension, as this character specifies the patient's phase of care for the injury. The extension A, initial encounter, is used for the entire period a patient is actively receiving treatment for the fracture, while D, subsequent encounter, is used for routine aftercare, and S, sequela, is used for complications arising after the acute injury. A good practical example is that the first time a patient visits the emergency department for a fresh fracture is always coded with an A. Remember that the A in the seventh character stands for active treatment or admission to care, not just the very first visit. Question 15. A physician performs an operative breast biopsy using an open incision and places a metallic clip in the biopsy site for future identification. What is the correct CPT code for this service? A. 19081. B. 19101. C. 19120. D. 19101-19283. Answer: B. 19101. This question tests the coding for a breast biopsy, specifically distinguishing between open and percutaneous/stereotactic methods. The keywords open incision and operative breast biopsy lead to the 19100 series, which describes biopsy of the breast. CPT code 19101 is used for an open incisional biopsy, and the guidelines state that the placement of a metallic clip or any marking device is considered an inherent part of the biopsy procedure and is therefore bundled. Code 19120 is incorrect as it describes an excision, removal of the entire lesion, rather than just a biopsy sampling. Here's a tip. If the procedure uses imaging like ultrasound or stereotactic, look at the 1908-119086 series, but if it's an open incision, stay in the 19100 series. Question 16. The ICD-10-CM code for a patient seen for a routine laboratory HIV screening is A. V20, V. Z11.4, Z. Z21, V. R75. Answer B. Z11.4. This question tests the application of ICD-10-CM Z codes, specifically for encounters focused on screening. The keywords routine laboratory HIV screening indicate that the patient does not have a confirmed disease, eliminating B20 and Z21, but is there for a preventive check. Z11.4 is the correct code for an encounter for screening for human immunodeficiency virus, HIV, as the patient has no symptoms or known risk factors beyond the general population. If the patient had a known high risk but was asymptomatic, Z72.89 could be an additional code, but Z11.4 remains primary for the screening itself. The takeaway is that Z codes are essential for reporting preventive, screening, and administrative visits that are not directly treating an illness. Question 17. Which term describes the condition of a yellow discoloration of the skin, mucous membranes, and eyes due to an increase in bilirubin? A. Cyanosis. B. Erythema. B. Jaundice. C. Pallor. Answer. A. Jaundice. This question tests basic medical terminology and anatomy/physiology, specifically the integumentary system. The key description is yellow discoloration of the skin, due to an increase in bilirubin. The medical term for this condition is jaundice. Cyanosis is a bluish discoloration, erythema is redness, and pallor is an unhealthy pale appearance. A practical example is a newborn with hyperbilirubinemia, who often presents with a temporary case of jaundice. Here's a quick way to remember. The yellow color of the skin makes you think of the yellow light on a traffic stop, which is a key characteristic of jaundice. Question 18. A 50-year-old patient undergoes an external neurolysis of the ulnar nerve at the elbow. Which CPT code is reported? A. 64708. B. 64718. C. 64721. D. 64719. Answer. C. 64721. This question tests the accurate coding of procedures in the nervous system chapter, 60,000 series, particularly nerve decompression. The keywords external neurolysis and ulnar nerve at the elbow are critical for code selection. CPT code 64721 specifically describes the neuroplasty and/or transposition of the ulnar nerve at the elbow. Code 64718 is incorrect as it describes neuroplasty for a major peripheral nerve, which the ulnar nerve is, but 64721 is the more specific code for the ulnar nerve at the elbow. The takeaway tip is that whenever CPT offers both a general code and a specific code for the same procedure, like 64718 versus 64721, always choose the most specific code that matches the documentation. Question 19. A surgeon excises a subcutaneous lesion measuring 2.0 centimeters from the patient's back. The excise diameter is 3.0 centimeters. What CPT code is reported? A. 11403. B. 12032. C. 11,603. D. 23,510. Answer. A. 11403. This question assesses the ability to code for the excision of a benign lesion in the integumentary system. Although the documentation does not state benign or malignant, lesions coded in the 11400-11446 series are benign lesions, and the question is designed to prompt selection of the appropriate benign code. The keywords subcutaneous lesion, back, trunk, and excise diameter of 3.0 centimeters correspond to CPT code 11403, which covers the excision of a benign lesion on the trunk measuring 2.1 to 3.0 centimeters. Always remember that, like malignant lesions, benign lesion excision codes are based on the excised diameter, the lesion plus margins, and the body area, trunk, face, etc. Question 20. A patient presents for a follow-up visit after a recent hospital discharge. This is an example of an A. Initial encounter. B. Subsequent encounter. C. Principal encounter. D. Final encounter. Answer B. Subsequent encounter. This question tests the correct ICD-10-CM guideline usage for the encounter concept, which is often tied to the 7th character extension for injury codes. An encounter is classified by the patient's phase of care, and a follow-up visit after a recent hospital discharge indicates the physician is managing a condition previously treated, making it a subsequent encounter. The term initial encounter is only used for the first time the patient presents for active treatment of a condition. The takeaway tip is that initial means active treatment is starting, and subsequent means the patient is in follow-up, healing, or receiving routine care. Question 21. A physician dictates an evaluation and management (E/M) service that meets the requirements for a high level of medical decision-making (MDM). What is the minimum E/M service level that can be reported for a new patient office visit using MDM? A. 99,202. B. 99,203. C. 99,204. D. 99,205. Answer: D. 99205. This question assesses the current E/M coding guidelines for office visits, which use only time or medical decision-making (MDM). The concept is the direct correlation between the level of MDM and the E/M code level. Based on the 2021/2023 CPT guidelines for office or other outpatient services, a high level of medical decision-making is required to meet the criteria for CPT code 99205. The other E/M levels, 99,202 to 99,204, correspond to straightforward, low, and moderate MDM levels, respectively. Here's an easy way to remember the relationship. Higher MDM complexity, high, always corresponds to the highest visit code, 99,205. Question 22. Which CPT code is used for the replacement of a pacemaker generator battery, only involving the subcutaneous pocket? A. 33,227. B. 33,228. C. 33,235. D. 33,208. Answer B. 33228. This question tests the coding for procedures related to the cardiovascular system, specifically the replacement of a permanent pacemaker component. The keyword replacement of a pacemaker generator battery, only, is the specific phrase found in CPT code 33228, which describes the removal of the old generator and insertion of a new one. Code 33227 is incorrect because it describes the removal of the old pulse generator without the insertion of a new one. The takeaway tip is to look for the word insertion or replacement in the code description to differentiate between simply removing a device and replacing it. Question 23. A 68-year-old patient presents with cataracts in both eyes and undergoes extracapsular cataract removal with insertion of an intraocular lens (IOL) in the right eye. Which CPT codes should be reported? A. 66,984. B. 66,982. C. 66984, RT. D. 66,984 to 50. Answer: C. 66984, RT. This question tests the coding of a key ophthalmological procedure and the use of anatomical modifiers. The procedure extracapsular cataract removal with insertion of an intraocular lens is described by CPT code 66984. Since the procedure was performed only on the right eye, the anatomical modifier RT, right side, must be appended to the code. Modifier 50, bilateral procedure, is incorrect because the surgery was performed on only one eye. The key is recognizing that code 66984 is the definitive code for the most common type of cataract surgery and must be reported with the correct laterality modifier. Question 24. A patient is brought to the operating room for the removal of a retained foreign body, a needle, from the foot. The surgeon makes an incision and removes the needle from the deep tissue. What CPT code is reported? A. 28190. B. 28192. C. 28193. D. 10120. Answer: C. 28193. This question tests the correct CPT code selection for the removal of a foreign body based on location depth. The keywords are retained foreign body, a needle, and deep tissue in the foot. The 28190 to 28193 CPT series is used for the removal of a foreign body from the foot. CPT code 28193 is selected because it specifies the removal from the deep tissues, which requires more extensive dissection. Code 28192 is incorrect as it describes the removal from the subcutaneous tissue, which is considered intermediate. The practical example highlights the difference between a superficial splinter, 10120 series, and a deep, complex removal, 28193. Always remember that the depth of the foreign body removal, superficial, subcutaneous, or deep, is the primary factor in code selection. Question 25. Which CPT modifier is used to indicate that a surgical procedure required significantly greater effort than typically required? A. 51. B. 22. C. 59. D. 78. Answer: B. 22. This question tests the appropriate use of common CPT modifiers for unusual circumstances. The concept is that modifier 22 is specifically used to communicate to the payer that a procedure was significantly more complex, time-consuming, or difficult than the typical service described by the CPT code. For example, a surgery involving extensive scarring or unusual anatomy may warrant modifier 22. Modifier 51 is for multiple procedures, and 59 is for distinct procedural services. The takeaway tip is that when the operative report describes something above and beyond the usual service, modifier 22 is your tool to request additional reimbursement. Question 26. A patient is scheduled for an injection of a therapeutic agent into the epidural space, transforaminal, at the L4-L5 level. Which CPT code is reported? A. 62323. B. 64483. C. 64484. D. 62321. Answer: B. 64483. This question tests the correct CPT coding for spinal injection procedures, a frequently tested area in the 60,000 series, nervous system. The keywords injection of a therapeutic agent, epidural space, and transforaminal are the direct descriptors for the code series. CPT code 64483 is used for the injection, transforaminal epidural for the first level, L4-L5. Code 62323 is incorrect as it describes an interlaminar approach, not a transforaminal one. The takeaway tip is to always differentiate between the approach, transforaminal versus interlaminar, and the substance injected, anesthetic versus steroid, when coding spinal injections. Question 27. An established patient presents to the clinic with an infected simple cyst on the back, requiring incision and drainage, IND. What CPT code is reported? A. 10060. B. 10061. C. 10080. D. 10120. Answer: A. 10060. This question tests the correct coding for the common integumentary procedure of incision and drainage, IND. The keywords infected simple cyst and incision and drainage lead directly to the 10060 series. CPT code 10060 is specifically for the IND of an abscess, furuncle, or carbuncle, which is appropriate for a simple infected cyst. Code 10061 is for a complicated or multiple IND. The E/M service for the visit is not reported separately unless a significant, separately identifiable E/M was performed. Here's an easy way to remember. 10060 is for simple IND, and 10061 is for complicated. So look for documentation of complicated factors like cellulitis or extensive wound packing. Question 28. Which of the following is the anatomical root word for bone? A. Mile/O. B. Class/. C. Condus/. D. Arthus/. Answer: B. Os/O. This question tests basic medical terminology, focusing on the root words for common musculoskeletal structures. The root word for bone is ost/o, which is commonly seen in terms like osteopenia or osteomyelitis. Mile/O refers to bone marrow or the spinal cord, condor/O refers to cartilage, and arthur/O refers to a joint. For instance, a disease of the bone is an osteopathy. The takeaway tip is that knowing a few basic medical roots can help you quickly translate many clinical terms during the exam. Question 29. A physician performs a diagnostic lumbar puncture. What is the appropriate CPT code? A. 62270. B. 62272. C. 62328. D. 62329. Answer: A. 62270. This question assesses coding for a procedure in the nervous system 60,000 series, specifically the puncture of the subarachnoid space. The keyword, diagnostic lumbar puncture, indicates the procedure is for sampling cerebrospinal fluid. CPT code 62270 is the correct code for a spinal puncture diagnostic. Codes 62328 and 62329 are incorrect as they describe the injection of a substance, therapeutic or anesthetic, not a diagnostic withdrawal of fluid. The key is to distinguish between a diagnostic puncture, 62270, and a therapeutic injection when coding spinal procedures. Question 30. Which CPT code describes the application of an ankle/foot cast short leg cast? A. 29405. B. 29425. C. 29515. D. 29440. Answer: B. 29425. This question tests the correct CPT code for the subsequent application of casts and strapping, the 29000 series. The concept is the proper use of the code set when the cast is applied after the initial definitive treatment. CPT code 29425 is the correct code for the application of a short leg cast, defined in the code description as the ankle/foot cast. Codes in this series are used for replacement or repair of a cast, not the initial application, which is usually bundled into the definitive fracture treatment. The takeaway is to check the 29000 series when a cast is changed or replaced, not when it is initially applied. Question 31. What is the standard global period for a major surgical procedure? A. 0 days. B. 10 days. C. 30 days. D. 90 days. Answer: D. 90 days. This question tests a core concept in billing and compliance: the definition of the global surgical package. A major surgical procedure is defined as having a global period of 90 days, which includes all necessary services normally furnished by the surgeon before, during, and after the procedure. Minor procedures typically have a 0-day or 10-day global period. For example, a major heart surgery has a 90-day global period, meaning subsequent routine postoperative visits are not billed separately within that time frame. Here is an easy way to remember. The term major is a 3-syllable word, and the global period is often considered the 3 months of follow-up care, 90 days. Question 32. Which modifier is used to indicate that a service was distinctly separate from other services performed on the same day? A. 51. B. 59. C. 76. D. 79. Answer: B. 59. This question tests the proper use of CPT modifier 59, which is one of the most frequently used and tested modifiers. Modifier 59, distinct procedural service, is appended to a CPT code to indicate that a procedure or service was performed in a different session, different site or organ system, separate incision/excision, lesion, or injury from another procedure performed on the same day. This modifier is crucial for overriding an edit, like an NCCI edit, when services are truly separate. Modifier 51 is for multiple procedures, and 76 is for repeat procedures by the same physician. The takeaway tip is that when two codes are bundled in the NCCI system but the documentation supports that they were performed at separate sites, Modifier 59 is the one to use. Question 33. A patient presents with fever, productive cough, and malaise. After an X-ray and lab work, the physician diagnoses the patient with streptococcal pneumonia. Which diagnosis code is sequenced first? A. J13, pneumonia due to Streptococcus pneumoniae. B. B95.5, Streptococcus unspecified. T. R05, D. R50.9, fever unspecified. Answer. A. J13, pneumonia due to Streptococcus pneumoniae. This question tests the ICD-10-CM sequencing guideline for confirmed diagnoses versus signs and symptoms. The keywords diagnoses the patient with streptococcal pneumonia indicate that a definitive diagnosis has been established. When a definitive diagnosis, J13, is known, codes for signs and symptoms, R05, R50.9, related to that condition are generally not reported. Therefore, the confirmed diagnosis of J13 is sequenced first. The takeaway tip is simple. A definitive diagnosis takes precedence over the signs and symptoms that led to that diagnosis. Question 34. What is the primary purpose of the Advanced Beneficiary Notice, ABN, in the context of Medicare billing? A. To obtain the patient's permission for elective surgery. B. To notify the patient that Medicare may not pay for a specific service. C. To track the total cost of the patient's yearly medical expenses. D. To waive the patient's financial responsibility for denied services. Answer. B. To notify the patient that Medicare may not pay for a specific service. This question tests the compliance concept of the Advanced Beneficiary Notice, ABN, which is mandatory knowledge for all coders. The primary purpose of the ABN is to inform a Medicare beneficiary before receiving services that Medicare may not cover the service in that particular instance. The ABN ensures that the patient is aware that they may be financially responsible for the service if Medicare denies payment. It does not waive financial responsibility but rather establishes it with the patient's signature. The takeaway tip is that the ABN is always a pre-service communication, giving the patient notice that they might have to pay. Question 35. Which procedure requires the coding of the anesthesia service based on time, not by the code's relative value units, RVUs? A. CPT procedures, e.g., 60240 total thyroidectomy. B. HCPCS Level 1 CPT, codes for non-anesthesia services. C. Anesthesia codes, 00100-01999 series. D. E/M codes, 99202 to 99499 series. Answer. C. Anesthesia codes, 00100-01999 series. This question tests the coding and billing methodology for anesthesia services. The concept is that anesthesia services are unique in that their reimbursement is calculated using a time-based formula. Base units plus time units plus modifying units, X conversion factor. CPT codes in the 00100-01999 series are the designated anesthesia codes and are the only codes in CPT where the time spent by the anesthesiologist or CRNA is a direct factor in calculating the billable units. CPT codes for procedures like 60240 are primarily valued by their relative value units, RVUs, not by time. The takeaway tip is to remember that the anesthesia section is the only part of CPT that fundamentally relies on timed units for reimbursement.